Bismillahirrahmanirrahim. Let's talk about the lumbar plexus. From L1 emerge two branches. One of them is iliohypogastric and the other one is ilioinguinal. फिर उसके बाद ये आप देख सकते हो कि that is from L1 and L2. ठीक है. From L1 and L2 there is another branch that is called as the genital branch. No, not the genital branch, just the genitofemoral nerve. We'll talking about its branches later. And from this L2, L3. From L2 and L3, that is the lateral cutaneous nerve, of the thigh. From the ventral, this is definitely the dorsal division. Yeah, from the dorsal division of L2, L3, and L4, it comes a nerve that is called as the femoral nerve. And from the ventral division of this L2, L3, and L4, the nerve that comes out is the obturator nerve. And from L4 and L5, there is another trunk that emerges which takes part in the sacral plexus, and that is the lumbosacral trunk. So from L1, we have two nerves. One is iliohypogastric and ilioinguinal. From L1 and L2, the genitofemoral nerve. From L2 and L3, the lateral cutaneous nerve of the thigh. From the ventral branches of L2, L3, and L4, the obturator nerve. And from the dorsal branches of L2, L3, and L4, that is the femoral nerve. And from L4 and L5, and taking part in the sacral plexus is the lumbosacral trunk. Now, important and the difficult part is the location of these nerves. So the first one that you see, the iliohypogastric, that is emerging at the lateral. It is emerging from the lateral part of the psoas, and that is actually between the posterior part of the psoas and the quadratus lumborum muscle, and it goes and it supplies the anterolateral muscles of the abdomen. And ilioinguinal, it has got the same course as that of the iliohypogastric, but it is slightly at a lower level. Talking about the lateral cutaneous nerve of the thigh, it is actually emerging in the at the lateral border of the psoas, and it runs downward and laterally across the right iliac fossa over the iliacus, and it reaches the anterior superior iliac spine over here. So obviously then it will be passing where? It will be passing behind the lateral end of the inguinal ligament, and it will enter the thigh. Because it's a lateral cutaneous nerve of the thigh, so it's very probable that it will be entering the thigh from the lateral end of the inguinal ligament, hence its name. Next, we'll be talking about the genitofemoral nerve. So it emerges near the medial border of the psoas major, and before it reaches this pubic crest, it divides into two branches. One is the genital branch of the genitofemoral nerve, and the other one is the femoral branch of the genitofemoral nerve. The femoral branch of the genitofemoral nerve is the one that we studied earlier when we were talking about the femoral sheath. So there's an arterial component of the femoral sheath, and along with the femoral artery, we have this nerve, which is the genital branch of the genitofemoral nerve. So that we've mentioned. And the genital branch of the genitofemoral nerve. The genital branch of the genitofemoral nerve in males, it is responsible for supplying the cremaster muscle, a content of the spermatic cord, and in females it is responsible for supplying round ligament of the uterus and the skin of the labium majus. Next, let's talk about the obturator nerve. Obturator nerve is responsible for supplying the obturator muscles, and it emerges near the medial border of the psoas major. ठीक हो गया. And it is actually crossed by the internal iliac vessels and ureter, and it will supply the obturator muscles after passing through the obturator canal. Last, let's talk about the femoral nerve, and where is the femoral nerve? This one is actually the femoral nerve that is emerging in the in the margin or in the gap between the lateral border of the psoas and the iliacus muscle. So it is going to supply the iliacus and the pectineus muscles, and after passing behind the inguinal ligament, it will enter into the thigh. In the thigh, it will be supplying the quadratus femoris and the sartorius muscles of the thigh. Okay, and it is also lateral to the femoral sheath, not a component of the femoral sheath. It is lateral to the femoral sheath. That's an important point to remember. One point that is left, that is the lumbosacral trunk. It is emerging from L4 and L5, as you see it in the form of 2 and 3 branches, and it enters the lesser pelvis by passing and grooving over this ala of the sacrum on the right and the left side. TKG, and it is actually posterior to your common iliac vessels, and it is related medially. On the medial side, we have the sympathetic chain, which is definitely on either side of the vertebral column, And on the lateral side of this lumbosacral trunk, we have this iliolumbar artery and the obturator nerve. So as you can see, this obturator nerve is lateral to it, and another artery, that is the iliolumbar artery, that we'll mention in another video. That iliolumbar artery is also lateral to it, and when it enters this lumbosacral trunk, when it enters the pelvis, it takes part in the formation of the sacral plexus. So I hope you've memorized the major details after watching this video of this lumbar plexus.